Welcome to today's episode of the Williams Summit 2020. My name is Julius. I'm a junior econ psychology major, concentrating in public health and neuroscience, and I'm going to be your student host for today. The theme for today's talk is digital health and the Williams graduate. I'm lucky to be here with Michael Greeley, who graduated with honors in chemistry from Williams College, received his MBA from Harvard Business School. He's currently a co-founder and general partner at Flare Capital Partners, where he focuses on healthcare investments. Thank you so much for joining us.
Julius, it's great to be here.
Awesome. So Flare isn't your first venture.
That's right.
Do you mind taking us through how you got to where you are after leaving Williams?
Sure, and I'll be very brief. So I graduated in '85, and it was in many ways a very different era, which makes me sound very old, but Wall Street was booming, and I found myself, notwithstanding I was a chemistry major at Morgan Stanley in the M&A group, and had taken actually my MCAT, so I really thought I was going to medical school. Obviously never ended up going to medical school, went pretty quickly to business school at Harvard, and then fell into an investment track. So I've been in the investment business for almost 30 years, probably just about 30 years. The current firm is one that I founded about 6 years ago. I've started 3 venture firms over those few decades, and have really become quite enamored about the intersection of kind of capital markets, healthcare, and technology. And I saw sort of a moment in time half a dozen years ago where the venture industry was looking for managers, firms like ours that were dedicated to this category. And at its essence, what we do really drafts behind a set of insights. And one is that, like financial services or advertising or commerce, were reinvented over the last 20 years, given mobility and the internet, that finally those forces would be more broadly deployed in healthcare, and that you'd see really important new healthcare tech companies being created. I just thought the entrepreneurs who are trying to solve those problems were underserved. So that was the genesis of the firm. We manage about $500 million today, have 24 or so active portfolio companies. And undoubtedly, Julius, as we're going to talk about, the world has been turned upside down by the health crisis. And as devastating as it is and will be, it certainly underscored, the premise of what we're doing is to reinvent the business of healthcare. And we're seeing all the, unfortunately, the stress fractures in the current models, how they need to be evolved. So
when you say current models, you mean in healthcare or within like the companies you invest in, or like the traditional healthcare? Or?
I think traditional healthcare models, obviously the whole fee for service paradigm was being evolved to be more value based. But I think there was a reticence around telehealth and novel care delivery models that they were harder to proliferate. And part of that was regulatory issues, like doctors couldn't serve patients across state lines, things that were structural. Some of it was generational. You had a level of executives who are kind of more my age than your age that aren't that tech savvy. And just in the last 6 weeks, we've all had to figure out how to be, massively tech savvy to treat patients virtually. And as devastating as this is going to be, and I have a pretty dark perspective as to what the next 6 months look like. It clearly shines a light on what wasn't working. So the role of analytics. It's a tragedy that the entire U.S. healthcare system somehow didn't fully see what was coming in over the winter when China starts shutting down cities. Why were analytics so poor? Why are our supply chains so inadequate? So it painfully has exposed some really important issues that we think technology and great entrepreneurs can go solve.
So you mentioned a couple words there. So electronic health, digital health, telemedicine, teledentistry. We hear a lot of these words, especially today. What do these mean, and like, what's the difference between them? And how is like the current healthcare data infrastructure, so things like HIPAA, important to their spread?
So I think you're right that this is an industry full of acronyms and buzzwords, and it can
Mm-hmm.
have a chaotic time. In fact, this isn't a scientific survey, but I bet there are 1,500 entrepreneurs today out trying to raise money to build one of those companies that you just rattled off. So
Mm-hmm.
there's a lot of activity and a lot of innovation. Um, Fundamentally, it's a system that in the old paradigm of fee for service was very volume oriented. They didn't really worry about outcomes, you know,
Mm.
and so they were just, it was like auto body shop. They were just repairing cars, pushing them out.
Mm.
And you now have a model where the healthcare system is taking risks. So it's a value-based model. If you're
Mm.
discharged from a hospital and you come back within a certain period of time, 90 days typically,
Mm.
there are penalties. And so you're now introducing into the healthcare system economic incentives and economic, rewards and penalties, and it's causing the executives who kind of run the healthcare industry in the United States to scramble to find novel solutions to manage people, patients, in different ways. And for me, as I said a moment ago, other industries were reinvented. So executives at
Mm.
American Express know how to acquire a new card member, know how to engage,
Fintech.
activate them, incent them. People running healthcare industry, for the most part, haven't had to worry about those types of dynamics. So,
Mm.
it ushers in these novel telehealth models and a greater emphasis around analytics. And as you touched on, the healthcare data infrastructure, it's complicated in part because of HIPAA and all the privacy considerations, but it's wholly inadequate.
Mm.
And again, these executives, as a venture capitalist, why I'm so excited, these executives are turning around and looking to the marketplace. I need a solution to do X, Y, Z.
Mm.
And the people who build those solutions are great entrepreneurs. And those are the
Mm.
people we're trying to partner with.
Mm. So why should we as students care about this? Like, what do you think? How do you think healthcare will be handled by us in the future, or how will we interact with our healthcare?
Yes, that's a brilliant question. So knowing I was going to be talking to you, I was introspective. I was thinking back in the mid 80s when I was at Williams and I was grinding away in a chemistry lab. I thought the way I would have an impact would actually be a clinician. And
Mm.
I think what's evolved over the last decade or so is you don't need to be a doctor to have real impact in healthcare. You can
Mm.
be a technologist, you can be an entrepreneur, you can be
Mm.
a great kind of executive who's going to build the 21st century hospital system.
Mm.
And the power of the Williams education, you hear it every day. For 30 years, I've heard it, is you're trained to be just a great thinker.
Mm.
And this is a system, it's 20% of the US economy that needs to be reinvented. And so you just need a lot of smart people who are passionate and frankly can kind of see around corners. So in many ways, I'm excited to see a lot of these young Williams grads come into the market and help us re-architect
Mm.
these legacy systems. And
Mm.
so for me, I think my parents are disappointed I never became a doctor, but I feel like I'm having an outsized impact on millions of people because of the people we're backing are going out and fixing big parts of the healthcare system. So it's another way to have impact. And it sounds so trite, but you can do well and do good as an
Mm.
investor in healthcare companies.
It's great to hear. That's great to hear. So I mean, obviously we're sitting on our couches because of COVID-19. Um, and I know you talked about it a little bit before, but how is the virus and the perception surrounding it negatively affecting healthcare and the businesses specifically you invest in?
Yeah, and so it's still very raw. I think a lot of us are trying to, at a minimum, quantify the impact.
Mm.
So in the healthcare tech space last year, there was just under $8 billion invested in, call it 400 companies, just order of
Mm.
magnitude. The prior year was so 2018 was slightly higher than that.
Mm.
10 years ago, it was about $1 billion. So it kind of nicely matured. My speculation for this year will be kind of $4 to $5 billion, so maybe a haircut of 40 or 50%, a pretty dramatic reduction in just the investment activity.
Mm.
And so as this started to hit our industry, and again, this is near real time, so over the last couple of weeks, all the venture funds went through kind of three stages of grief. One was we looked at our existing portfolio companies and we said, who's at risk of not making it? And so if you thought that this was a 12-month desert we had to cross, you had to then stack rank the ones that you were
12 months, wow.
It could be longer, maybe it's shorter, but it's certainly the rest of this year. And so you kind of triage your existing portfolio and you took a bunch of actions, and many times you're cutting costs, which unfortunately means really headcount reduction, layoffs. And then we started to look at, and we're kind of midway through that exercise, then we started to look at all the new investments we want to make. Do the terms have to change? And so if we thought something was worth $10 million today, 6 weeks ago, it's probably now worth $6 million. So we're going through kind of the new investment pipeline. And then the last stage is more of an optimistic stage, which is, and I've now been through 4 cycles. This is the 4th that I'm going through. Coming out of these cycles are great times to start and scale companies. They're super disciplined. They're really focused on only things that create value. And so I've said to my team, let's not, as bad as this is going to be in 2021 and 2022, great companies are going to be created. So let's get out now and start to meet those entrepreneurs. So, I mean, maybe just to summarize, this is going to be a devastating, I think, 6 to 9 months. The one thing I can't assess, and you probably have a better perspective than I, if the loss of life runs to several 100,000 people, what does that just do to the country's psyche? We've never experienced that before. But, we're all going to be here. We'll all survive. Most of us will survive.
Yeah.
The arc of our careers, this will be something we'll reflect on. It's not going to, totally derail people. And as I said, and I know you're interested in the sectors that I'm investing in, if nothing else, this really reaffirms we need real innovation in healthcare so that these things don't happen again.
And so that's actually leads us into my next question, which is you're in a unique environment where your portfolio is consisting entirely of healthcare companies. So obviously different impacts depending on where on the value chain they're operating on. But how do you think us being inside, there have to be new ways to implement health. How do you think that'll affect telemedicine, telehealth, and the companies you're invested in?
Yeah, so I think one thing that confounded a lot of us up until about 2 months ago was telehealth utilization rates were low single-digit %. People just didn't really use those platforms. And so now, I'm sure that number is, high double digits, like 80%. We just physically can't go. It's not lost on me that great healthcare ultimately is a human-to-human interaction. So I don't think once we're kind of let out of our houses that we immediately, that we continue just to be solely focused on virtual visits. There'll be a more of a blend. But I think people are seeing the power of, if nothing else, just you and I talking in this format, just a sense of empathy that I'm able to tell you what's bothering me and you can give me some reaction. And importantly, we can time shift. So if I can't get into your office between 9 and 5, you can do 8 p.m. So the attributes of this format, I think, will become pretty embedded in how we provide care. But ultimately, great care, and there are certain surgery, for instance, that has to be.
It's impossible.
It's impossible, obviously, virtually. So it'll still have its limitations, but it'll be much more standard of care.
That's awesome. So I mean,
we just recently invested in a company. We haven't announced that we seeded it. It's in the behavioral health space. No, we had no idea, really, around suicide ideation, and we had no idea, obviously, what was about to roll through the economy. But you can see there are going to be use cases that are most appropriate virtually.
Mm.
Because you need a rapid response, people who are in crisis, people who really around behavioral health issues, that this format is almost uniquely positioned to address those populations.
Mm.
Again, I don't want to sound naive or too upbeat. This is going to be a very dark 6 months, I fear.
Mm-hmm.
I guess, not to sound glib, I'm glad that I'm not a consumer brand investor, or an electronic scooter investor. A lot of those businesses are going to be completely wiped out.
Mm.
Healthcare feels very enduring.
Yeah. Wow. That's crazy. And so just kind of going back to Williams and like the education you received, where do you see it in your day to day, and like, especially because we're adapting to new times, where do you see the advantage in it, and where do you see the disadvantages
of the Williams education?
Yeah.
I mean, the advantages, I think, are pretty self-evident.
Mm-hmm.
Brilliant training, your classmates, the exposure you have to new ideas, so that seems a little hackneyed, frankly, to talk about. Disadvantage, if there is one, that your generation is confronting, I think there's pressure on recent college grads to be more specialized sooner in their careers. And so you have to kind of declare an industry focus, a geographic preference. And so I think, frankly, when I was getting out, the notion of being a generalist was more prevalent, and you could show up and say, hey, I went to Williams, I'm super smart, and I'm kind of a jack of all trades. Today, 30 years ago, there were 15 great colleges in the country. There are now 150 great colleges in the country. So people are differentiating themselves, I'm observing, earlier in their career based on who they know in their industry, and their level of kind of networks, strength of their professional networks. And, when you go to a liberal arts college in, the woods of Massachusetts, you're not in that intimate environment. And so, if I'd been doing healthcare tech investing for 30 years, I'd be a much better healthcare investor than for 15 or 20 years, just because it's really all about the people in your professional domain. But that's not a knock on Williams. It's just it's an observation. I think, unfortunately, for your generation, you're going to be kind of steered towards declaring areas of interest sooner.
Yeah.
As evidenced by our earlier conversation, your insights around healthcare, I probably couldn't spell healthcare in Williams, and you've got really deep on some themes around interoperability and virtual care, and so I can see it just in the way that you're thinking about this. You've really become quite expert in this area, and not versus being more of a generalist.
Thank you. Well, thank you so much for joining us. The last thing we're asking guests is, if you were to make a bumper sticker you want to leave the ETH entrepreneurship community with, what would it be? It could be one sentence. It could be really anything.
The sun also rises. Maybe that's try to be upbeat. There's always
I like that. I like that.
Anyway, sun also rises.